Good morning, everyone. We are glad you could join us for our virtual research seminar series. Today's presentation is titled Coronavirus Disease 2019, Turning Threats into Opportunities. My name is Camilo Ansara. I'm Associate Director of Business Development and Industry Relations at the MASH Academy, Keck School of Medicine. And for those of you who are not familiar with the MASH Academy, our mission is to empower the convergence of research disciplines to address challenges in human health and disease. And we are here as a dedicated team to help facilitate connections and collaborations across USC with the Keck School of Medicine, with other researchers, as well as externally with industry. And we're very excited to bring the seminar to you today. Before we start, however, I just wanted to touch on a few housekeeping items. We have 3 presentations today and a single Q&A session at the end after the 3 presentations are done. And for the question and answer session, I would like to ask that you please use your hand function. When you do so, I'll be able to call on you and allow you to speak, and you'll be able to address the speakers directly and ask your question. If you prefer, you may also use the Q&A tool to write in the question, but we do encourage you to use the raise your hand function on your Zoom window, just because you'll be able to ask the question directly to the speaker and the context of the question is better understood. Also, if you choose to type in your question, please don't forget to indicate who your question is directed to. And finally, I wanted to let you know that this webinar is being recorded. Both the slides and a recording of the presentation will be available on the MASH YouTube website and the MASH website within a few days. Okay, so let's get the presentation started. And as mentioned, we have 3 amazing speakers today, and it is now my honor to introduce them to you. Our first speaker is Dr. Ali Gholamrezanezhad. Dr. Gholamrezanezhad is a dual-trained radiologist and nuclear medicine physician with over 14 years of clinical postgraduate experience. He's assistant professor, Diagnostic Radiology at the Keck School of Medicine of USC. Following Dr. Gholamrezanezhad, we'll have Brandon Fields. Mr. Fields is a 4th-year medical student at the Keck School of Medicine of USC. He earned his undergraduate degrees from the University of Colorado Boulder in integrative physiology and classical guitar performance, and is now pursuing his medical degree here at USC. Following Mr. Fields, we will hear from Dr. Bhushan Desai. Dr. Desai is Assistant Professor of Research, Vice Chair for Research, and Director of Clinical Research in the Department of Radiology at the Keck School of Medicine. And with this incredible lineup, I'm happy to introduce their presentation, which is entitled Coronavirus Disease 2019, Turning Threats into Opportunities. Just please welcome Drs. Gholamrezanezhad, Dr. Bhushan Desai, and Mr. Fields.
Good morning. Perfect. Good morning, ladies and gentlemen. Thank you for giving me this opportunity to give a talk. My name is Ali. My last name is Gholamrezanezhad, probably the longest last name you have ever heard. I'm Assistant Professor of Clinical Radiology with Keck School of Medicine. It's a great honor for me to be a part of this seminar today. I would like to speak about coronavirus disease 2019, COVID-19, what we did over the last 10 to 11 months, what we learned, and what we achieved. Next. Next, please. I've received research funding from ACER. Next, please. Okay, we responded to COVID-19 very early. I think it was the 1st or 2nd week of January that we started working on COVID-19. The very first step was to identify the threat, which was probably the easiest part of our work. I'm an emergency radiologist, so my job is to identify the emergencies and threats and to respond them. We had a couple of meetings in early January to see what we can do about this disease. But the main problem was lack of information. There were not that many publications out there in the very first few weeks of January. Probably like a couple of case series, not an actual research, maybe a couple of case reports, probably like less than 10 publications. So as a solution, next slide, please. I suggested that do a literature review on similar coronavirus diseases. Most of these pneumonias that are caused by coronavirus family viruses have overlap in their clinical pictures and imaging pictures. So I said, let's go over the similar coronavirus diseases like, SARS and MERS and learn from them. We knew that coronavirus diseases can easily turn into an outbreak or even a pandemic. So we knew that we really need to be prepared. This is the first study that we did. And next slide, please. As you see here, we tried to compare the imaging features of SARS, MERS with limited available data of COVID-19 to collect some information. At the same time, to educate people, we needed cases. So we wanted to get some cases from those countries that had disease in early January. In the US, there were not that many cases, probably a few cases in January. We wanted to contact China or Iran, those countries that were affected by the disease, but the problem was legal issues. Because of sanctions, there were issues, we were prohibited to do any collaboration with those countries. So we contacted the university lawyers, we had a couple of meetings with them. We discussed what we need from China and Iran, what we have to give them, what we are receiving from them. They investigated the issue, probably contacted the Department of Treasury, IRS, to make sure that there is no legal barrier. And after a while, they gave us a limited permission to do collaboration and get some information under specific circumstances and conditions. So then we can get some cases from Iran and China and we put it in our publications to educate the radiology community in the US and probably entire world to be prepared for this outbreak and pandemic. Next slide, please.
I apologize for interrupting, but could you speak a little bit closer to the microphone?
Sure. Radiology was a front line of diagnosis. Why? Because at the very first few months of outbreak, there was no RT-PCR test specific for coronavirus disease. Those countries which were successful in controlling of the disease mainly relied on imaging. They did in China, in Iran, in South Korea, they did a lot of CAT scans, they did a lot of X-rays. So we tried to educate our community with some information about the imaging features of COVID-19. This was the very first publication of American College of Radiology on imaging features of COVID-19. And in this article, we didn't only work on the clinical picture of the disease, but also we made some recommendations and suggestions of the optimal management of these patients in the Department of Radiology. Why? Because at that time, there were some concerns about nosocomial transmission of the disease. There were some questions that you do a lot of CAT scans, so there's a high risk of transmission of the disease. If you don't mind, go back to the previous slide. Yes. There was a concern about when we do a lot of CAT scans and X-rays, the patients and the staff are at risk of transmission of the disease. We can have our staff at risk and they can put the patients at risk. So based on our suggestions and recommendations in this article, American College of Radiology prepared this visual abstract and distributed this visual abstract to all the radiology departments in the US and advised them to follow these steps for best practice of radiology to make sure that the hospital staff, radiology staff, and the patients are not at risk of disease transmission. Next slide, please. This is probably one of our best works so far. It was published in mid-February. At that time, there was some information about COVID-19 in literature, but it was very scattered, probably few research projects were published. There were several case series and a lot of case reports. In this article, we tried to make a consolidated report of all the available publications and cases to that time, which were like about 919 cases. And we collected all those information to have a better understanding of the imaging features of the disease. This work has been cited for more than 500 times so far. Next.
Can I, sorry to interrupt, some of our attendees are saying that the voice, they can't hear you very well. So if you could speak closer to the microphone or.
So is it better now?
Yes.
Okay, perfect. After that project, we tried to go to more specific and more details of the disease. For example, in this article, we proposed a new classification system for the imaging findings of COVID-19. Next, please. Then we tried to look at more different subgroups of the disease. For example, in this article, we looked at coronavirus disease in patients with autoimmune diseases and vasculitis. Next. In another article, we worked in COVID-19 in patients with cancer. Next. In this article, we worked on COVID-19 in kids in pediatric population. Next. We published several letters and editorials to cover almost every single aspect of clinical pictures of the disease. Next. One thing that at that time was not very common in literature was the long-term consequences of COVID-19. Based on the experiences on SARS and MERS, we knew that even if the patient recovered, there is always kind of scar in the lung tissue. So in a couple of articles, we try to focus on the possible long-term consequences of COVID-19, like this one and the next one. This one, which was probably the first article discussing the possible long-term consequences of COVID-19, and the next one. And in this article, we tried to cover the brain and central nervous system complication of COVID-19. Next one. We didn't only cover the clinical picture of the disease, we tried to cover the non-clinical features and management part of the disease. The first study that we did was comparing the management protocol of COVID-19 in different countries. We started with China, where the disease started. Then we collected data from South Korea, Japan, Iran, which had a lot of cases. Then we tried to collect some information from the management protocol in Europe, like UK, France, Germany, Spain, and then compare it to our protocol in the US and Canada and Mexico. And based on this comparison, we made a lot of information and recommendation about the optimal management of COVID-19. Next. Then one of the main concerns actually at that time about COVID-19 was the fact that we were doing a lot of X-rays and CTs, especially in China. They were doing a lot of CAT scans, and that high burden of radiation raised concern about future increase in the rate of malignancy and those stuff. This is why we tried to introduce a new protocol, low-dose chest CT protocol for COVID-19, to make sure that the radiation burden in the population is not that high. Next. Then we published our own experience in LA County Hospital to show people what we did and what we learned here. Next. We made a lot of recommendations for preparedness of nuclear medicine department on what is the best approach to deal with COVID-19. Next. It was in June that they decided to reopen the country and restart the function of radiology department. And at that time, there were a lot of concerns about the optimal plan for restarting function of radiology department. This is why we published this one. We proposed some strategies and guidelines and recommendations on the best approach to restart the function of radiology departments. Next. We did the same thing for nuclear medicine departments. Next. Oh, yes. And this one is probably one of our best articles so far, published in the Journal of the American College of Radiology. In this article, which got CME credit from American College of Radiology, Dr. Mayers actually gave a lot of good recommendations on the optimal mass casualty planning in situations like COVID-19. This article and this lesson actually can be employed in future for any other mass casualty. Next. I was impressed by the speed of science in combating with COVID-19, how fast our knowledge increased. If you remember, this was the very first article that we published in AJR. And if you see, our knowledge at that time was very limited. For example, here in this green area, we said that COVID-19 is a disease of lungs, and it's different from SARS and MERS because it doesn't involve the other body organs. Next. It was only a couple of months later that we found that, oh, our information were limited in January, so we were wrong. COVID-19 can affect almost every single body organ. So we published this article to correct ourselves and teach people that there are a lot of extrapulmonary manifestations of this disease. Next. Next one, please. We did two national surveys, one on the impact of COVID-19 on radiologists and the other one on impact of COVID-19 on medical students. And we found that medical students and radiologists in the country are under a lot of pressure and stress because of COVID-19. Next. These research projects actually got a lot of attention in media like this one. Next. We did a lot of work and we couldn't do any of these works without collaboration from other universities. The very first university that helped us was our neighbor UCLA, but afterward we got collaborations from UC San Diego, Johns Hopkins, Case Western Reserve University where I did my residency, UPenn. We published a lot this year actually with UPenn. Mayo Clinic recently in our book project, scientists and physicians from Mayo Clinic are helping us. We had collaborations with scientists from NIH, Mass General, University of Texas, Uniformed Services University, and recently in our book project again from Edinburgh University. It was an international collaboration. Most of the work was done in the US, but we had a lot of collaborators from Italy, Germany, Spain, Iran, China, Japan, and Hungary. Most of the work was done by the emergency radiology attendants. It was a great honor for me that I was working with these people. They were so kind that supported us and helped us. Like the first person, if you don't mind, can we go back to the, yes. The first person said, I remember when we started working on these projects, he had a lot of overnight shifts, but even during his night shifts, he spent a lot of time, Dr. Sadir Balakrishnan. Dr. Lim Meyers, he was very busy with his overnight shifts in the county hospital, but he did a really, really good job in a lot of management articles, like those articles that were published in American College of Radiology. Sean and his wife worked a lot on several of articles. They helped us a lot. And also Dr. Sheen, he published our experience in LA County Hospital. Next. And the most important person, I don't know how to say thanks to her, our section chief, Dr. Reddy. For several months, every single day, she supported us. She checked on us to see if we need any help. And she made a lot of collaboration. I don't know, we couldn't achieve any of this without her help. Next, our research assistants and postdoc fellows, Salar, Aydin, and Sana, they really worked hard. And Sima is probably the youngest member of our team. She's a, I think, third-year medical student from Iran. When she joined us, she had no experience in research. She never had any publication or anything like that, but so far she has published like 3-4 articles with us, and she was very hardworking and successful. Next. Amir from UCSD was one of our collaborators. He worked on a couple of articles. Next. Okay. And we started these projects by help of these two guys that recently got married. Melina and Sohail, they are our collaborators from UCLA. For the first 3 or 4 articles, they did a really, really good job, and without their help, we couldn't achieve this stuff. Next, please. And this is our scientific output over the last 10, 11 months. So far, we have published 31 articles. We have 6 accepted articles. We have submitted 7 more articles, citation record of more than 1,400, more than 300,000 times downloads. I recently signed a contract for a new book project with Wiley, the publisher. And for this project, I really need help. If any of our colleagues in other departments, divisions are interested to help us in this book project, I'm more than happy to get help from other people. We definitely need help on this book project. It will be published in the first quarter of 2021. And we had like 3 grand round talks, a lot of media interviews like with Nature and Wall Street Journal. We achieved this much only because of collaborations, international collaborations, interdepartmental collaborations. And this is what we learned. I had a lot of friends in other universities. So whenever I needed help, I just started contacting them. Even when I didn't know some people personally, I contacted them. 50% of the time they didn't respond, but 50% of the time they were very open for collaborations, and we made friends, and now we are doing more collaborations. So I was not shy in contacting people. Team during the time of COVID-19 was tough. We had more than 200 Zoom meetings, but we learned that even in this situation, we can be very productive and very effective. Thank you. The next speaker is the leader of our medical student team, one of our best medical students, Brandon. Brandon, please go ahead.
Thank you, Dr. Gholamrezanezhad, for the introduction. And thank you, everybody, for being here for our talk today. Can you please go back a slide? So I'm here to discuss team building in the time of COVID-19, and specifically how we were able to involve a lot of the graduate students here at Keck, both medical students, master's students, and research year students, all to conduct essentially virtual research in a time when we weren't able to go physically into the labs. So virtual connectivity in the time of COVID-19, of course, we're all very experts at Zoom these days. And Zoom video conferencing was key to building our teamwork and making sure that everybody was collaborating in a way that was efficient and productive. We used a lot of phone calls. We just were very communicative as a team with asynchronous messaging, email, text messaging, and voicemail. Social media was also very important for the recruitment of our members, something that we used to distribute our survey, for example, was just posting on Facebook pages for the medical student survey to try and reach medical students around the country. Distribution of our research tools by email. We built extensive databases to do so. And we also utilized things such as ResearchGate for centralized sharing of our ideas and our publications. Just ways to find more collaborators, ways to get our messaging out there more quickly and more efficiently. Next slide, please. Just going to take a moment to highlight our research team members. Up in the top left, we have Saif Azam. He's a PGY1 currently. He'll be a radiology resident here at Keck next year. Angela Judd, Anjali Doshi, Joseph St. Pierre, Catherine Song, Jennifer Pan, and myself, all fourth-year medical students. Drayton Harvey, current MD PhD student. Ryan Lee and Daniel Mosley, Dean's research students, and Claire Justin, third-year medical student here at Keck. We also got a lot of interdepartmental collaboration with the Integrative Anatomical Sciences master's students, Natalie Demerjian, Rachel O'Shea, Michael Chen, thank you very much. So now I'm just going to discuss how we were able to put together these projects in the virtual environment. As Dr. Gholamrezhad already mentioned, we pursued this project on a survey of nationwide United States radiologists. This was a student-driven virtual research project where the medical students, the master's students were involved in adapting the survey questions, drafting the IRB protocols, assembling the contact list, and utilizing these open knowledge sharing sources, such as the Johns Hopkins University COVID-19 tracker. All of this was done remotely with people all over the country, contributing to this team effort to make sure that we could get a balanced distribution of our survey, as well as analyze it in a way that was efficient and productive. We had many virtual meetings to make this happen. We frequently communicated through WhatsApp. We had regular video conferencing with the research team members, including Dr. Gholamrezanezhad and Dr. Desai. And we had this real-time document collaboration through Google Docs, Microsoft Office 365, so that everything was happening in real time. It wasn't so much that we had to email back and forth all the time, but everybody was on the same page by accessing these live documents. I think these are things that are key in the time of COVID, when we're collaborating on multiple projects in a virtual space with no office workspace. Next slide, please. So as previously discussed, we found that radiologists were experiencing a great deal of anxiety during the time of COVID. The median anxiety score on a scale of 1 to 10 was a 7, with 50% of our respondents reporting a 7 or higher. Most common stressors were family health, personal health, and financial concerns. We found that radiologists were experiencing something that we refer to as vicarious traumatizations. The idea that while not traditionally considered a first-line worker, there is a great deal of anxiety that happens as being somebody who is, shall we say, second-line worker, or in the reading room and watching the colleagues go out and having the exposures that may be putting their health at risk. Common coping mechanisms including family time, exercising, and watching television. Interestingly enough, citing the stressor of personal health was predictive of higher self-reported anxiety scores. Not unsurprising that folks who are going to work and afraid that they're going to become ill might have higher anxiety. Also, individuals who responded that they had no coping needed were less likely to report these high levels of anxiety. Childcare assistance for healthcare workers also remains an area of opportunity. Many people wrote in the write-in comments that they had childcare burdens that they no longer had because caretakers were no longer able to come to the home to care for the children. We do know that healthcare workers have some of the highest childcare duties of any workforce sector in America. And this was something that was unanticipated in the survey design, but we never would have been able to capture had it not been for diligent sifting through of the comments and reading of the comments that we captured through REDCap distribution surveys. And future directions, we did also conduct a similar student survey with medical students, where our unpublished data suggested medical students are similarly experiencing undue stress due to anxiety. Here and abroad, we found that drivers of anxiety included inability to complete exams or rotation, as well as utilization of mental health services. These were all things that we were able to bring together through a common centralized database, and usage of tools like REDCap and email distribution allowed us to gather this data on a very, very large scale for people who were able to write in and report these information to us who had possibly no other avenue to do so. Something else that was key in our research projects in the last few months was collecting a lot of the literature that is in published works and creating these review articles. Sometimes it's very arduous to be reading 10, 20 articles at a time, and being able to succinctly summarize these recommendations was a key contribution that we were able to make to the published works of the COVID-19 pandemic. For example, here we discussed the review of guidelines for resuming non-urgent imaging and procedures in radiology during phase 2, where we discussed that the main risks to resuming these transmissions are risk of infection and inability to meet demand. We know that things such as cancer imaging is urgent, can't wait, and yet in the time of COVID, these may result in higher risk of transmission, both to staff as well as to patients who are coming in through the scanner bays. Not to mention the backlog from all the canceled scans. The keys to the recovery we said will include the risk assessment, identifying pacing items, and continuing review. We, in the following slides, will discuss the tiered approach to reopening, where it is really contingent upon review and revision of the existing protocols to make sure that they are still relevant and that they are still safe. And continual emphasis must be placed on protecting healthcare workers through social distancing and infection. Here we see the tiered approach to radiology reopening, where in each different phase there is a key benchmark review process. As we learn more and more about the disease, as we learn more and more about the demand for imaging in the next few months, it's important that we continually review our procedures and make sure that what we're doing is, again, safe for everybody involved, but also meeting the demand. So another literature review that we were able to put together, as we discussed briefly previously, a review of these diagnostic technologies that are being implemented in countries worldwide, especially during the first phase of the pandemic. We were very well aware that there was a heterogeneous response that was very region-based. So while there are many recommendations against things, for example, the use of chest CT to diagnose COVID-19, things that are important is that we take into account local subspecialist expertise, the time that it takes to diagnose, and the diagnostic accuracy. There was a famous article published from a group in Iran where they were actually utilizing a WhatsApp social media network to upload CT scans of folks who were suspected of having COVID-19 so that they could access an international collaboratory network of subspecialists in thoracic imaging, where there might not have been local subspecialists available to read these scans. And in this way, these physicians were able to utilize social media networking to get this kind of expertise and bring North American volunteers, for example, and volunteers from the Iranian capital who were able to give more targeted diagnostic information with regard to CT scans that were made in perhaps more rural regions of the country. And so we see that these national institutional protocols must consider these local availability of resources when we're making official recommendations. Interestingly enough, there are countries, South America, China, that are starting to use these machine learning and artificial intelligence algorithms to risk stratify COVID-19 imaging, especially when the demand was incredibly high and everybody who was coming in was receiving some sort of imaging, whether it be a chest X-ray or a chest CT. These are important workflow efficiency optimizers that help radiologists direct their attention to the most important and the most high-risk scans, as we know that with people perhaps working at home or perhaps working at lower capacities than previously, it's ever more important that we preserve the radiology workforce in the days to come. Some other important avenues that we found to disseminate our research was that things like giving invited expert commentaries. NeuroDium is an online neuroscience periodical where we were able to summarize existing findings of neurologic sequelae of COVID-19, as well as give an example of stroke at our institution. As discussed previously, as information came forward, we learned quite a bit more about the extrapulmonary manifestations of COVID-19. And just finding more avenues to speak about these things and get our information out there was really key. And we were very thankful to NeuroDium for hosting our information and for helping us further discuss these findings. Some ongoing projects within the department include grants and funding. One that I would like to highlight is this emergency imaging protocol for pregnant patients, a multi-institutional, multi-specialty collaboration. While not directly related to the COVID-19 research productivity that our team is engaged in, this directly came from building our virtual research team. We were able to utilize a collaboration with medical students and master's students to apply for the American Society of Emergency Radiology grant here, which is funded at $10,000 for, oh, can you go back one, please? At over 1 to 2 years. This was very important because we used all of the foundational work that we had built over the last few months with Zoom conferencing, with live document editing, and frequent just collaboration to bring this project together for people who were, again, living in different parts of the country, living in different time zones, and yet we were able to come together with this virtual collaboration. So it is possible. Our project goals included the resident education of emergency imaging protocols in pregnant patients in emergency medicine, obstetrics and gynecology, and radiology residency programs nationwide. So next animation, please. And Dr. Gholamrezanezhad was awarded as the principal investigator the 2020 ACER grant. And I'll close with just saying that the lessons that we've learned from the collaboration in the time of COVID is just maintaining connectivity in whatever way is possible, and making sure that everybody is buying into frequent communication at an even greater rate than may have been necessary previously. And yet, with Zoom, with all the virtual spaces that we have, we can recreate the physical spaces that we used to have, as long as there's buy-in from all the stakeholders, and it can be very successful. Thank you very much.
Thank you, Ali and Brendan. My name is Bhushan Desai, and I'm the Assistant Professor and Vice Chair of Research for the department. So I'm going to talk more about how did we conduct scientific research during pandemic. Back in March 2020, our department had more than 60 ongoing funded clinical trials. And to support these trials, we have a huge clinical research support team, which includes clinical research coordinators and research assistants. But then the pandemic struck, and around March 15th, we received that memo from Keck School of Medicine that most of the clinical research projects have to be placed on hold. So at that point, Ali and I quickly reassigned our research priorities. COVID-19, given the time-sensitive nature of the research, definitely took the top priority, and we reassigned all of our team members to work on several COVID-19 related projects. Sorry, I'm trying to advance to the next slide. Okay, what did we do next? So we quickly realized that in order for us to do any meaningful scientific research, we first need data. And in order to create or collect data on COVID-19 patients, we had to create an IRB approved COVID-19 repository, which essentially allowed us to collect imaging and associated clinical data from all RT-PCR positive patients from the Keck Hospital, Verdugo Hills Hospital, and the LSE USA Medical Center. We then created our database. So our clinical data set is currently stored in REDCap database, and all our de-identified imaging data, it is being housed on our servers. We also realized that our team was not enough to help us with this data extraction and data entry effort. So we expanded our team to include medical students, postdocs, and research volunteers. We then also started working on specific IRBs, which can then reference the COVID-19 repository IRB and do specific hypothesis-driven research projects. In the next few slides, I'm just going to mention some details about our repository. In terms of the data elements, we have collected the demographics data, which includes age, sex, race, ethnicity. We have the travel and the contact history. We have extensive data on the comorbidities. This includes the cardiac history, diabetes, COPD, obesity, hypertension, and so on. We also have data on the presenting symptoms and any of the symptoms which were happened post-admission. We also have longitudinal data on all the physical examinations the patients had, all the vitals and the lab values, which includes the CBC, CMP, lipase, C-reactive protein, interleukin-6, D-dimer levels, and so on. We are also collecting data on the interventions. Did the patient need intubation? Was the patient on BiPAP or CPAP? We are also collecting data on the medications. What kind of medications were these patients receiving during the hospital admission? And more lately, we are also trying to categorize the patients based on the disease severity. This is based on the WHO guidelines, and it categorizes the patients as mild, moderate, severe, or clinical. So those are our data elements. Where are we in terms of the current data set? Right now, this is an ongoing effort. And I think we have data on more than 2,000 patients from LSE USC and approximately 300 patients from the Keck and the Verdugo Hills Hospital. This includes the range from March 12th to August 26th. Next, I'm going to show some data distribution slides. So in terms of the demographics, we categorize them as below 30, 30 to 60, and above 60. As you see here, of the county patients in our database, currently we have approximately 700 patients between 30 to 60 years of age. And a lot of patients from Keck and VHH have been above 60 years of age. In terms of the ethnicity, as expected, county has a significantly high Hispanic patient population. And we have good number of non-Hispanic patients from Keck and Verdugo Hills Hospital. In terms of outcomes, we define them as did the patient just come to the ER, or did the patient need actual admission? Was the admission associated with the ICU stay, intubation, or did the patient succumb to the disease? So in terms of the patients who were admitted, we have approximately 500 patients at county who got admitted, but not in the ICU. Approximately 180 patients from Keck and VHH. There were 200 patients currently in the data set who were admitted in the ICU. We are still tabulating the data on the intubation status, but of these 1,000 patients from county, there were 51 which were deceased, and of the 300 patients from Keck and VHH, we had around 54 deaths. In terms of the imaging data, again, this is an ongoing data entry effort. It's a massive effort because of the number of patients and the amount of data out there. As you can see here, we have essentially collected all the available imaging data. Of the 1,000 patients from county, we have approximately 2,600 chest x-rays, similar approximately 2,000 chest x-rays from the Keck VHH. And then we have also collected all other types of imaging the patient might have. This includes abdominal x-rays, ultrasounds of the extremities especially, any kind of CTs the patient had, or MRs or PET CT. So how did we do this? Again, this definitely requires a village. And as you see here, this is a list of all our contributors and collaborators from USC. Several faculty members led by Dr. Ali Gholamrezanezhad contributed to this effort, along with several of our research staff members. I'll definitely like to give a special shout out to Melissa Perkins, who is our research coordinator and essentially taking the lead on this COVID-19 repository project. We also had some medical students contributing to the repository. We collaborated with Dr. Paul Halton, Susan Butler, Dr. Chang, Dr. Baidur, Dr. Banerjee, and Dr. Young from the LSE USC Medical Center. Also a special thanks to Dr. Armand Dorian and Anna Safarian. They helped us get those required approvals from the Verdugo Hills Hospital so that we can extract data from the RT-PCR positive patients at VHH. And then Dr. Neha Nanda has been instrumental from USC in terms of not only helping us with setting up the repository, but is closely involved in collaborating with us on several ongoing research projects. And then from Keck, we also had Neil Baharuz and his team help us with some of the data extraction efforts. Additionally, we have also collaborated with the Viterbi School of Engineering. So Dr. Assad Oberoi and his team at Viterbi, they are looking at developing several prediction models using deep learning and machine learning approaches. In addition to everything that Ali and Brandon mentioned, which is more than 40 published manuscripts, we were also involved in grant writing. So we submitted an NIH R01 grant in collaboration with the Viterbi School of Engineering, which was focused on, again, prediction of clinical prognosis and disease severity in COVID-19 via different machine learning approaches. We also wrote grants for some other funding agencies, which included the prospective evaluation of pulmonary and functional recovery pattern in patients with COVID, and the addressing the healthcare disparities in Latinx population. And next, these are some of the ongoing projects. Again, this is not a complete list. This is just an example of the kind of research which is ongoing, focused on COVID-19. So in collaboration with the Viterbi School of Engineering and the USC Radiomics Lab, we are developing machine learning-based predictors for ICU care. In collaboration with the Division of Cardiothoracic Imaging, we are looking at comorbidity as a risk factor for determining clinical outcomes, as well as chest radiograph severity score in determining the clinical outcomes. And then additionally, USC Radiomics Lab is also looking at creating some prediction models using texture analysis of chest x-rays. So there's a lot of research going on in this space. Again, for those who are on the call and have some bandwidth, especially if you're medical students or research staff at USC, we definitely need more help in terms of continuing our data extraction and data entry effort so that we can continue building on our repository. And for those researchers on this call and in the USC community, again, the repository was set up with the goal of providing this data set to the USC community so that we can learn more about this COVID-19 disease. So yeah, with that, I would like to end my talk. Thank you for your time and attention. And I think we can open up the floor for questions. Thank you.
Thank you. Thank you to our speakers. There's a lot of information. It's impressive the amount of work that has been done and the quality of the work. And Also very nice to see the amount of collaborations that that we generate so much good data. So we're going to open up now for questions, and we have about 14 minutes. If anyone has a question, please go ahead and use the raise your hand function, and I'll allow you to speak, and you can speak to the speakers directly. Please also indicate who your question is directed to. Alternatively, if you prefer, you can also type in your question in the Q&A box.
Is there a question from Murad?
No, he raised his hand to talk about the sound, the quality of the sound. That was
Okay.
not. So, and if any of you has a question to within your group, please feel free to discuss that too. Okay, so I have a question. You mentioned a little bit about, you talked a little bit about the ongoing projects that your team is conducting. Can you please elaborate a little bit more on what you plan to do from now on, moving forward? What will be the focus of your research, and what do you expect to see in the field? And my question can be answered by any of the three speakers.
Do you want to speak our ongoing projects? And then I can talk a little bit more.
Sure. Okay, so in terms of this COVID-19 repository that I spoke about, again, there are several groups within USC which are using this repository to answer different questions. The goal of this repository was not only to have it accessible to the USC community, but also the community at large. So eventually this entire data set is going to be shared with some of the national repositories, right? There have been some repositories through the Radiological Society of North America. NIH has created its own repository. So eventually we are going to contribute to those larger repositories. But the goal here is to learn more about this disease. So that's why we have been trying to collect as much data as possible from the patient cohort, which can help us answer different questions. Like what Ali has done is outstanding. He has not only focused on the pulmonary manifestations of COVID-19, but everything else. There are so many extra pulmonary manifestations of the disease. And one of the hot topic right now is using artificial intelligence and machine learning techniques, which can help in prediction of the ICU stay or prediction of the prognosis of the patient. A lot of this can be then used for eventually the distribution of the vaccines as well. If you can identify that these are a group of patients with a specific comorbidities or ethnicity or the specific age group who are expected to have a worse outcome, then we can decide on the vaccine distribution strategy. So those are some of the, again, ongoing projects. And Ali, if you want, if you would like to add more.
Well, as Bhushan mentioned, most of the clinical features of the disease have been already addressed, and there are hundreds of thousands of publications on the clinical features of COVID-19. But one feature, one aspect of the disease.
We can't hear you very clearly.
You hear me now?
Yes, it's better. Thank you.
As I said, most of the clinical aspects of the disease has been already studied. Well, one aspect that needs long-term studies, follow-ups, is the long-term consequences of COVID-19 on the lungs. Previous researchers on SARS and MERS did a long-term follow-up for over 18 years on these patients. And for COVID-19, we need to do the same thing. So one of the research projects that we are trying to get some funding for it is long-term follow-up of these patients for several months to several years to see how much scar from COVID-19 pneumonia is seen in their lung and how much of their lung function is lost after this kind of infection. This is another important aspect of the disease that needs long-term follow-up for several years.
Thank you. We do have a question from the audience. Dario Wong is asking, what is the current plan for the possible second wave? Are there prospective studies waiting for patients to come?
In imaging wise, to be honest with you, we don't have any imaging study to enroll specifically for the second wave, but as Bhushan mentioned, for our repository, we are still enrolling patients in that repository.
Right. And I believe USC has kicked off a vaccine trial. I believe it's from AstraZeneca. And there are, when I was speaking with Dr. Michael Dubé earlier, there are a few other vaccine trials which are in the pipeline. So including the rapid testing. So I'm sure there'll be more clinical trials to offer to our USC patients and to the LA County. But yeah, that's the kind of research which is being undertaken by the infectious disease department. There is always an imaging component associated with it. So we are always involved on the imaging aspect. But yeah, I'm sure USA will be opening up more clinical trials and adding more biorepository samples in their repository. Because in addition to our COVID-19 repository, which is more imaging and clinical based, there is also another repository which is being set up by the Keck School of Medicine, which is collecting the actual specimens of the patients.
Dario, there's a question from Dario. Another question I think he wants to follow up. Please go ahead and unmute yourself and you're able to speak.
Sure. Hi, everybody. Great presentation. I just wanted also to tell you that there's also other COVID projects that are going on across campus in terms of collaboration also with the engineering school that we're doing with respiratory therapy and other groups that here in radiology we're also participating in, and that you know, hopefully we can move forward and get some of the practical PPE things taken care of with the engineers on this side. In terms of we're doing things like modeling airflow in rooms to see what spread looks like from a particle standpoint and stuff like that. Just to give a heads up to anybody else, especially in the mesh group that might be looking for more engineering based projects.
Right. Let me add, Dr. Wong is an outstanding research professor in our department, and again he initiated a grassroots campaign in terms of 3D printing PPEs, and again as he correctly mentioned, he has been collaborating very closely with several schools on the UPC campus, and they have done some outstanding work, which has been highlighted again by several news media agencies. And it took him several months to figure out the correct production method for the PPEs, and I think he has contributed a lot to the PPE creation using 3D printing technologies.
That's great. Thank you. We have a few minutes left. If anyone else has a question, please let us know. Again, you can type the question in, or you can raise your hand and we'll call on you to speak. Questions, anyone? 4 minutes left. Do you want to add anything? Any of the speakers, do you want to add anything that you forgot or would like to add at this time before we close?
Just one more time to say thank you to all our team members, specifically Dr. Reddy and Bhushan, because without their help, and Brandon, without their help, we couldn't achieve any of this. We had a lot of meetings, to be honest with you. We had like Zoom meetings till like 2 a.m. More than 200 Zoom meetings, some of them more than 4 hours. And during the time that all people were stressed out about the disease, and they were so kind to join us, to help us. And it was a really good experience of teamwork. We learned a lot, and hopefully we can continue this type of works.
Definitely, it was an impressive amount of work, high quality and very collaborative, which is very, very nice to see in such a short amount of time. So if anyone else has questions, let me see. Yeah, there's one last question. Murad Uktens says, a large number of publications were cited, listed. If you could recommend 3 of them, which ones would they be?
The very first 3 publications that have been cited more than 1,000 times over the last 10 months, because they were very first publications on COVID-19 imaging in the US. And at that time, there was not that many publications out there. So they were used as the main source of imaging information of COVID-19. The timing of those publications were very important. Maybe these days we have like more comprehensive literature, but they were very time sensitive. So we published them in a very sensitive time. I would say those 2 publications in HAR and the main article, the very first special report of the Journal of the American College of Radiology, those 3 articles are probably our best works.
If you don't mind sending me the references via email, and Murad, please either connect with me or directly to Dr. Gholamrezanezhad. We'll share the specific references so you have them in your inbox.
I'll be more than happy to share it.
Thank you. Great. Okay, so I would like to thank our speakers today for their great presentation. Thank you for the time to speak to us today. Really appreciate it. So stay tuned for our next virtual seminar series happening very soon. Again, thanks everyone for joining us today, and see you soon. Goodbye.